The Tennessee legislature gave its final approval to a bill on Thursday that would restrict the use of shackles and other restraints on pregnant inmates, the latest state to limit what medical experts say is a routine but dangerous practice for pregnant people and fetuses. More than a dozen states have no laws restricting the shackling of pregnant inmates, according to the American College of Obstetricians and Gynecologists, and those that do often make exceptions for public safety or other reasons. It's unclear exactly how many pregnant inmates are shackled or restrained each year, but experts say it still occurs in U.S. prisons and jails, where an estimated 58,000 pregnant women pass through annually. A 2018 study found that, among hospital nurses who said they cared for incarcerated women during pregnancy or the postpartum period, 82.9% reported that their incarcerated patients were shackled sometimes to all of the time. It's a very demeaning and dangerous practice, Corene Kendrick, deputy medical experts roundly criticize the practice of shackling pregnant inmates. National organizations, from the American College of Obstetricians and Gynecologists to the American Medical Association to the Association of Women's Health, Obstetric and Neonatal Nurses, oppose it, or support restrictions. Dr. Carolyn Sufrin, an associate professor at the Johns Hopkins School of Medicine, says having an inmate shackled during labor and delivery presents challenges for doctors and nurses. For example, if medical staff detect a deceleration in the fetal heart rate and are worried about fetal distress, they may want to have the pregnant inmate change positions. In other cases, if an inmate requires emergency C-section, they'll need to be quickly transferred to the operating room. All of those things are impeded if that person is shackled to the bed, and we don't have time to be negotiating with an officer to unlock the restraints so that we can provide EMR. Even before labor and delivery, pregnant inmates who are shackled face other hazards, such as blood clots. Sufrin said restrained inmates are also at a higher risk of falling and are unable to break their fall, which could result in bleeding or even stillbirth. Despite the widespread opposition to shackling pregnant inmates, not all states prohibit it by law. At least 37 states have laws limiting the shackling of pregnant inmates, after Alabama Governor Ivey signed a measure into law last week. Some of those states go as far as banning shackling throughout pregnancy as well as during labor, delivery and the postpartum recovery period. Federal law also restricts the practice,